Snoch piercings, pros, cons, advantages, disadvantages. Also going to go through what you should know beforehand, getting the piercing done, what the piercing experience is going to be like, healing, jewelry, living with the piercing, and what happens when you say, I don't need this around anymore, and I'm abandoning it. Coming up next on Pros and Cons by a Piercer, Season 2, Episode 101. Hello and welcome to the Body Piercing and Tattooing channel. If you're new here, we always like to have people subscribe, like, and do all that stuff you're told to do in every video on YouTube. Please do so. I hope you're enjoying the videos. I hope you find it helpful and useful, but you may not know who I am. My name is DaVo. I'm a professional body piercer. I have been since 1994, and I own and operate the Axiom Body Piercing Studio, located here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So we're talking about the Snoch piercing, which I don't know if I'm pronouncing correctly. This piercing, including the name, is a combination of snug and conch. It's done right up where the antihelix kind of connects or starts to the conch area of the ear. It's kind of done right on the edge. So it's done. It can have kind of two placements, either directly through the antitrachus or it can be slightly below it. But it's generally done kind of in that upper corner of the ear and kind of at an angle to match whatever that anatomy is shaped like. As far as history, there is a long history of people doing piercings in this area. It dates back to ancient times. As far as it's pretty much in every culture and ethnic group on the planet. We learned to pierce our ears and we all went crazy with it. But this particular piercing pretty much is a modern invention. There's not really, I would say, I first started seeing this about 5 years ago. I had done this piercing before that, but we didn't have a name for it. And nobody came in and asked for it. It was one of those things where I had a client come in and say, I want to do something unique. And I'm like, you know what? I've never seen somebody have this piercing, and did it. She healed it out, enjoyed it for life. I haven't seen her in probably 10 or 15 years, but it looked great. I just, then we didn't have the variety of jewelry, so it'd probably look even better now. Let's move on to the pros, the advantages of things that make you go, hey, for me. Starting with number one, fits into your anatomy. This is a piercing that, if you have the correct anatomy for it and the imagination of a decent piercer, you can place this so it looks like it fit into that area and accents how that ear looks. It is one of those piercings that is going to be very unique to you because no one else has a conch or that area shaped the same in most cases. It also adds kind of a nuance to the that area of the ear that we usually don't do a lot of piercings in below that flat. Large, huge variety of different jewelry to wear in this. Of course, you're stuck with post-style jewelry. That can vary from person to person depending on your anatomy, but the good news is that most people pierce these with either threaded or threadless jewelry. There is a huge amount of different ends that you can put in there that could fit the shape of the ear right there or accent it, from just a little tiny ball or a little tiny gem setting all the way up to some type of curvature jewelry that's going to fit really well there to stuff that's dangling off of it. There's a lot of things that you can do depending on the shape of your ear and the placement of the piercing. Number three, widely socially acceptable. Pretty much when it comes to ear piercings, you're not going to have problems getting a job or have some type of weird social interaction with somebody that's prejudiced towards piercings. It's also easy to hide if you have longer hair. It's not something that everybody needs to know you have. It's not one of those piercings that screams, I'm pierced. Number four, if you haven't gotten this already, this is a very rare and unique piercing. That may change as the piercing becomes more popular. Who knows? But it's one of those piercings that not everybody has and can be something special for you. And the last one, number five, has a long history of healing. This can be a little bit more troublesome than, say, a conch piercing would be or an upper ear helix or what have you. But it's not nearly as bad as it's going to be with a snug piercing. It's kind of in a nice little protected area, so it has that advantage that conches do. So this does have a long history of healing with little or no issues. Now it's time to move on to the cons, the disadvantages, the things that make you go, not even on my worst day. Starting with number one, You may not have the anatomy for this piercing. If you hadn't figured out already, this is a piercing that really relies on having the correct shape in the area to fit the jewelry and place the piercing properly. If your ear is overly folded there, you may not be the best candidate for this one. This kind of piercing really does better with things that are kind of a little bit more curved or a little less drastic, if that makes any sense. Number 2, swelling. Like any cartilage piercing, this will go through stages of swelling, mostly in the first couple weeks. And then it's really, as I'm going to go into later, sensitive to trauma, so even later in the healing process. So this is one of those piercings where you do have to concentrate on isolating and reducing that swelling. Number 3, this piercing can close extremely rapidly. It's one of the many piercings that if you like it, you definitely want to leave something in it. It's not something you can take out for a few days and not have problems getting it back in. Number 4, cannot sleep on the piercing. So this may change how you sleep. You do need to take that into account or make preparations in advance to make sure that's not going to be an issue. Number 5, as already mentioned, this one will be sensitive to trauma. Most cartilage piercings are. Location and everything, it is a little bit more isolated than other ones, but at the same time, it tends to be a little thicker tissue. There's a little bit more going on there, and snagging that thing is going to hurt even after the piercing heals and could cause the piercing to suddenly flare up. Now let's talk about preparing or what you should know beforehand, or both. First off, if you're involved in any type of sporting event, any type of organized activity or anything or work that has a dress code, talk to the person in charge beforehand to make sure this piercing is not going to be an issue. I don't think it will be, but it's not a bad idea to do that ahead of time. Nothing would suck worse than having this very great piercing and then being basically told, nope, you don't get to do this unless you take it out. Otherwise, go home and don't come back. Make sure your piercer is knowledgeable, experienced, especially with this particular piercing, because it's not one we do every day, is going to willingly go through a consultation with you and discuss risks, aftercare, your anatomy, placement, everything else beforehand. They should be very knowledgeable, and they should be very passionate about what they do, and part of being passionate about what you do for a living is sharing it with absolutely anybody that will listen. Next thing you want to know is whether or not your piercer does provide aftercare instructions, both verbal and in writing. I know a lot of places like, hey, thanks, here, pay me, use this QR code. I'm not a big fan of that. It takes a couple minutes for a piercer to sit down and just basically go over the basics of aftercare. And they should be providing you with written instructions on how to take care of it that include the jewelry size, who did it, when it was done, when they suggest downsizing, how long the average healing time is, and all that good information plus contact information and written instructions on how they suggest taking care of the piercing. To me, it's just laziness. I understand everybody's on a time constraint and everything else, but the reality is the more educated your clients are, the less work you have to do later. You're going to have to practice cross-contamination prevention. Making your house kind of safe for that in advance is a good idea. Clean your sheets. Make sure you have plenty of clean clothing on hand. If you have a pet, train them to not be in the bed with you. All of those things ahead of time and kind of getting your life in order to make healing this piercing as simple as possible. It's a good thing to do in advance. This piercing may take up to a year to heal. Make sure you're ready to make that commitment, because it's not something you can take care of for a couple of months and then go, yeah, it's healed, and then not take care of it. You are going to see problems. This jewelry will need to be downsized probably at some point because we put a longer post in to allow for swelling. You are going to downsize that. You need to make plans ahead of time. That will probably involve buying another post and going back to the piercer. Some people do it for free, but not everybody. Ask your piercer in advance if they have aftercare product in stock, usually sterile saline. If they don't, purchase it ahead of time so you have it on hand the day of the piercing so you don't have to go out and look around for it. Lastly, this may affect what type of clothing you can wear. Like this will affect over-the-ear headphones, hats, helmets, glasses maybe. Think about these things in advance and what has contact with that area. Most of this stuff should be totally avoided during the healing process. If they can't be avoided, then they need to be disinfected on a regular basis, and you need to be very careful about how much trauma they're going to cause. So consider all this stuff in advance before getting the piercing. Don't get the piercing and then realize all this stuff. Now let's talk about the piercing experience. Most people say on a scale of 1 to 10, this one lies between that 2 to 5 range. Not really extremely painful, but definitely not something you want to do every day. First thing we're going to do is we're going to do a consultation. We're going to cover things like what it's going to take to heal it, what should you do every day, cross-contamination prevention, which I'll go into detail a little bit later about when we get into healing. Also, check your anatomy, talk to you about any type of medical issues or allergies you may have, that sort of stuff. To give you as much information as they possibly can in a short period of time to let you know what it's going to take and entail to heal this piercing out. And they're also going to evaluate your anatomy and see if that's even an option with that particular piercing. With that all done, we pick out jewelry. Usually this will steer you in a direction of the style and type and size, and maybe give you a lot of choices as far as what you want to put on the front of that. That can vary from really simple to really complex. Usually with these piercings, I would suggest something a little bit more low profile, smaller, and not really complex. Then we have you fill out a waiver and sign it. The waiver is a questionnaire of sorts. Do read through it because it does cover, of course, releasing us to do it, that you're an adult and you actually can consent to do it. Whether or not you're intoxicated or not, we generally will not pierce anyone that's intoxicated or under the influence of any controlled or uncontrolled substance. If you have any health issues, you want to read through that too and discuss that with your piercer. And if the piercer doesn't have the correct answer, talk to your doctor about it. Same thing with prescriptions. Once that's all done and we have the green light, we will begin cleaning off the area, setting up, getting all our tools ready, then washing our hands. We'll probably already washed our hands. Then putting gloves on and disinfecting the area, usually with a surgical scrub. I like providine iodine, also known as betadine. Then we'll clean that off, mark the piercing, have you take a look at it and see if it's what you pictured. With this piercing, it's kind of hard to see. So I generally suggest if you have a friend with you or maybe the piercer can do it for you, take it, or you can do it yourself. Some people are good at it. Other people like myself are terrible at taking pictures of the side of their head. Basically, it's usually easier to kind of tell the placement on a phone photo or on a photo than it is to try to do the mirror thing. Some people are really good with the two-way mirror or two-mirror trick, but it just might be easier to take a photo. Understand, when it comes to marking is a collaborative effort. If you envision it a little bit up or down or move slightly, discuss that with your piercer. Don't use your finger. Tell them what you're thinking. With a mark done, we put you in a reclined position, inject a needle in and through, usually into a cork or a needle receiving tube. Then we push that out with a guide pin, hook the jewelry on the back, push it back through, put the top on, stop any bleeding that may be occurring. Usually there's maybe a little bit of slight bleeding, but not a lot. Sometimes I'll lay the saline on there because it kind of, with cartilage piercings or piercings through cartilage, they tend to be right afterwards really hot. So it's one of those things that kind of make it feel better right off the bat. You're probably going to experience a little bit of slight throbbing and aching for about 3 to 5 minutes. Varies from person to person. And then it's going to be tender to the touch. Other than that, not really too bad. Healing. Average healing time in this piercing is anywhere from 3 to 12 months, during which time you're going to need to clean twice daily using a sterile saline spray. Personally, I like Neomed's Piercing Aftercare. It's what we stock here. It's what we sell here. You can find it at most reputable piercing studios, even online, etc. A lot of price gouging going on, to be honest with you, on the online market. Some of those prices are getting kind of nuts. Anyway, that's beside the point, because I know what they're paying for it, and I know if they're a larger retail, they're paying a lot less than I am, and they are sticking it to you. So if you can't find a local business to get it from, probably a better option. If you cannot find that, it does happen. There's some parts of the world where that's just not available. The things you want to look for, first off, is that it's in a metal can, and it is under pressure. It should also state that it is sterile on the package. When you turn it over and look on the back, you should only see 2 ingredients, water and sodium chloride, nothing else. If you see egg whites or red sea salt or angel tears or the lion blood or any of this other nonsense, that is not what you want. It's going to have additives in it that could cause issues. And if it's an antiseptic additive, or chances are is it's not sterile to begin with. Now, the biggest difference you're going to find in products is how the saline is delivered, how that nozzle works. With the piercing Aftercare, it comes out in a fine mist. With those, you just spray both sides of the piercing, let it stay in contact. You really don't even need to wipe it off or anything, just let it air dry. With the kind that comes out and kind of like a squirt gun, the nozzle is really, it'll hit you from 20 paces. That stuff, you can't really spray directly on there. I've had some clients say if you just hold it down a little bit, it works pretty well. But you may not find that being able to do that. An option would be to do compresses. Take a sterile piece of gauze sponge, saturate it to the point where it's very damp, and then lay it against the piercing area for about 5 to 10 minutes. In both cases, you want that saline in contact for about the same period of time. The other thing I suggest doing is into your shower, pull your hair and everything out of the way, and let the water flow over the area for about 30 seconds to a minute. What we're doing with the saline and rinsing in the shower is removing the discharge that's going to harden, collect, and deposit on the jewelry. The reason we want it off there is when the jewelry slides or moves, it'll agitate the piercing, which could lead to issues and doesn't feel very comfortable. If you have an obsessive amount of it or it's just not coming off, go see your piercer, have them take a look at it, and have them clean it for you. Do not run to the medicine cabinet and start pulling out everything tipped in cotton or a sharp point or some stranger on the internet suggested. Start digging around in there. You're going to cause problems. The other thing that I think is a misconception is a little bit of discharge on that jewelry being left on there is not an issue. Mainly what we're concerned about is a large buildup over time. So if there's a little bit on there, don't freak out, and it'll probably come off the next time you rinse it. Swelling can last anywhere from 3 to 5 days, sometimes a little bit longer, and it can come on later on in the healing process if the piercing experiences trauma. Ways to avoid it, avoid contact, avoid trauma to the area. The more you isolate that area, the more less movement in the area, and the less contact, the less swelling you're going to see. Also, sleeping your head elevated above your heart will keep the blood from pooling in the area, thus increasing the swelling. If you're seeing a lot of swelling first thing in the morning, that's why. Taking anti-inflammatories, if you've never had problems with over-the-counter anti-inflammatories such as ibuprofen or Tylenol, shouldn't be an issue. If in doubt, especially if you're on prescribed medication, speak to your doctor before you use it. The other thing is CBG oil has been shown to help reduce inflammation. Just take it as directed. Don't pour it directly on the piercing. No, that's not what you do with that stuff. You need to practice cross-contamination prevention. Common sense things. Wash your hands before you handle it. No oral contact or exchange of bodily fluids on or around the piercing. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with it. Do not submerge the piercing in bodies of water you can't control the quality of, meaning no swimming. I know you think that pool is perfectly clean and safe, and I know you think that pond is, you can see your feet from 30 feet away. The reality is if you have a body of water that's large enough for you to submerge your whole body in and move around in, it is filled with microorganisms. Your piercing is an open wound, meaning that if one of those microorganisms work their way into that open wound, it will cause an infection. Stay out of the water. There's also the issues with pollution in natural waters, in the chemicals and sea salt, et cetera, in pools, and the issue of moisture causing problems. It's best just to wait until after it's healed. Then you can swim all you want, unless you, of course, you get a new piercing. Keep pets away from it. Do not let them sleep in the bed with you, especially the smaller animals like to sleep up by your face and steal your breath while you're sleeping. Avoid contact with wet hair, cosmetics, hair products, hats, helmets, headbands, over-the-ear headphones, glasses, phones, until the piercing is healed. All of those will cause issues or could contaminate the piercing. Avoid playing with the piercing. I know it's new and it's fun and different, but messing with the piercing over and over again prolongs swelling, increases the likelihood of infection, prolongs healing, and causes other issues. Leave it alone. First 3 to 5 days, you may experience some slight bleeding, not a great amount. That's perfectly normal. Also, of course, as I mentioned, there'll be tenderness to the touch and etc. The thing with tenderness to the touch, when you bump it, it tells you you bumped it. And it is screaming at you every time, hey, I'm working here. You need to avoid this area or it's going to take longer. Jewelry. Jewelry should be left in at all times. This is not a piercing that you can leave abandoned for a long period of time and not have issues getting the jewelry in. It's basically only take out jewelry to put new jewelry in. Should downsize in anywhere from about 4 to 8 weeks. 6 weeks is kind of the sweet spot for most people. We want it far enough in the healing process we don't have to worry about swelling, but also if it starts getting snagged and caught on things and causing problems, we want to downsize as soon as possible. The other issue with downsizing is there is a tendency with cartilage piercings to migrate out of position, partly because how that longer barbell is sitting there and how it's weighted. Once it starts moving out of alignment, there's not much you can do other than re-piercing to put it back where it needs to be. So downsize is what I'm getting at. Best option with this, I suggest, is either a barbell or a flat back labret stud. It really depends on the shape of the back of your ear. If it's kind of more in a corner, barbell is going to work better, mainly because you don't have sharp points pushing against it. If it's more flat or flat enough, a disc is going to be a better option because it has a lower profile. So it really depends on your anatomy and the placement of the piercing. Whenever getting new jewelry, it's not a bad idea if you wear glasses on a regular basis to try those on and make sure they don't have contact with the piercing. It's really weird, the differences in how all these manufacturers make glasses and how that bow sits in the back. Usually this one isn't interrupted a lot, but it's something you really do want to consider when you're getting new glasses or when you're getting new jewelry. Living with a piercing. Check the ends. If it's threaded, check the ends on a regular basis. Threadless stuff, it's not a bad idea to pinch down about, every once in a while. But with checking the security of the ends, I generally suggest doing it weekly. It's just easier. Pick a day of the week, like Thursday, and Thursday's ball checking day, and you just check them. If, even after the piercing is healed, if you experience trauma and you're starting to see throbbing, aching, or any other issues or swelling, consult your piercer immediately. With swelling, sometimes if there is enough trauma, a healed piercing will start swelling. And with piercings like this, where we kind of want a tighter fit of the jewelry, having that tight fit in there may cause additional issues, and you may need to have a jewelry change just until it simmers down again. As you should probably already know, piercing needs to be isolated. Just because it's healed doesn't mean that you can bang things against it, and etc. Treat it with gentleness. It is a hard piece of metal through soft tissue, and if there's enough trauma, it will cause issues, even a piercing that's decades old. Lastly, leave the jewelry in at all times. Only take out to replace. If you like the piercing, leave something in it. Abandoning the piercing. You've had enough. You want to get rid of it. If it's during the healing process or it's already healed and there's absolutely no signs of infection or other problem, it's not a problem to remove the jewelry. What will probably happen if you're during the healing process is the holes will seal over on both sides and slowly close, just like any other puncture wound. If it's a piercing that's been in there for a couple of years, it'll probably collapse in the center and then fill outward. It will appear open for quite a few years, even after the jewelry has been removed. If there's any signs of problems, regardless if it's healed or unhealed, consult your piercer or a doctor or medical professional before you remove the jewelry. The biggest risk with this is if there is an infection, is that the infection in infected tissues being trapped deep inside the piercing and not be able to be pushed out of the body. It may require further medical treatment. So, when in doubt, ask ahead of time. Lastly, sebum. I talk about this a lot on these videos. Sebum is a waxy oil, has a consistency of cream cheese. Has a very distinct odor to it. If you smelled it, you'll know what it is. It does collect in crevices. Also tends to be more so around scar tissue, and a piercing is a crevice that's scar tissue. What it mainly does, this sebums does, is it lubricates hair follicles, moisturizes the skin, and makes us watertight, or helps to make us watertight. Don't worry about it. It's completely normal. I've had people call me up saying, I squeezed my eyebrow piercing and this stuff came out and it's gross. Why are you squeezing it? It's perfectly normal, perfectly fine. It will wash away. Do you have this piercing? A snooch? Please leave a comment. Let us know what your experience was like and any hints that you may have or maybe something we missed or I missed. Also, if you have any questions about this piercing or any other ones, please leave a comment. And if you have a very burning question, but you like it when we answer them live, check out our live stream talking about piercing. Every Monday, 8 p.m. Central Standard Time, me and Scott sit down. We talk about a subject, and then we answer whatever viewer questions are in the chat. Till next time, here's WLA Piercing Seal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I'd love to see you for your piercing needs in the future. Have a good day. Take care, and we'll see you in the next video.